Gynecologic oncology is a women's health subspecialty where we focus on treating cancers such as ovarian, uterine, cervical cancer. Endometrial cancer is the most prevalent, with over 65,000 new cases diagnosed a year in the United States. Ovarian cancer is the deadliest gynecologic cancer, but only occurs in about 1 in 80 women. Cervical cancer is a lot more rare in the United States, thanks to excellent screening that we have here, as well as increasing uptake in HPV vaccination. We can greatly decrease the risk of cervical, vaginal, or vulvar cancer with the HPV vaccine and regular screening. Unfortunately, there's no screening test for ovarian or uterine cancer. We focus on knowing signs and symptoms of those two cancers. For ovarian cancer, the biggest risk factor is having a family history of ovarian cancer or having a known genetic mutation like a BRCA mutation. In endometrial cancer, the biggest risk factor is obesity or having irregular periods in the 30s and 40s. For cervical cancer, the risk goes up with an immune-suppressed condition such as HIV, but it can also be increased by smoking. The worst thing you can do to increase your risk of cervical cancer is not seeing your gynecologist, not having pap smears regularly. The HPV vaccine can prevent cervical, vaginal, or vulvar cancers later in life. Whenever we can, we utilize robotic surgery, even single-site robotic surgery for some of our cancers and more complex gynecologic surgeries. Anytime I see a cancer patient come into the office, the first thing I think about when I see them is how can I get to that point where they're able to say, I beat cancer.